for going live, but.
Good afternoon. Good morning, everybody. Welcome once again to the Joint House Senate Work Group on the Essential Workers bill. I think it's 581 on the House side, I think. Senator Augustine, welcome, everyone. Let's keep it moving. Let's not waste time. Session's rolling right along, so we know where we left off before. Laura, David, if you can sort of get us to the next steps and we can proceed. I want to welcome Delegate Solomon, who will be joining us representing the Appropriations Committee, where the bill is jointly assigned. And I believe Ms. Waterman, she is joining our group as well. So with that, without further ado, let's get started.
Okay. Well, so David and I just wanted to sort of briefly recap the areas of potential agreement that were reached at the first meeting, and then we're going to go into the worker benefits and protections in the bill and the obligation for essential employers. And if time allows, we will go to the scope discussion that we started last week. So the group spent time last week discussing the definition of emergency, and sort of limited it to the second prong in the bill, so that it would be a public health incident, occurrence, or outbreak that is the subject of an executive order, executive declaration, or executive proclamation. The group also discussed the role of the state in announcing when an emergency is in effect or occurring, so that instead of it being a process through which MEMA or a local emergency management agency would make that sort of determination, it would just be, I guess, the governor or the state that would be more generally deciding, making the executive order, executive declaration, or executive proclamation. So we're going to share screen and start walking through some of the provisions of the bill. The first section we're looking at, if you have a handout at home or a print of the bill, is 31605. Hold on 1 second. Can you all see this? The bill? Okay.
Ooh, can you make it a little bigger, Laura?
Just for you, Mr. Chair.
I got the old eyes in here.
Okay, is that better?
Yes.
Okay.
By definition, it's better.
It's 125%. Is that okay? Sufficient?
Can we get 135?
150?
There you go. Deal.
Okay. So this is the section that defines what is an unsafe work environment. So an unsafe work environment means any circumstance present at a work site that renders an essential worker unable to perform required daily duties because of the physical condition of the work site. Because the physical condition of the work site, represents a reasonable threat to the worker's health or safety. And then the bill says that unsafe work environment includes unsanitary conditions in the workplace, an essential employer's failure to provide PPE, lack of employer adherence to federal and state health and safety standards related to the emergency, an essential employer's failure to develop and enforce health and safety protocols related to the emergency, and an essential employer's failure to notify workers of illnesses, broken or improperly functioning equipment, or any other dangerous or hazardous conditions which represent a reasonable threat to the essential worker's health or safety. And so we've laid out what constitutes an unsafe work environment, and then the legislation further says that subject to certain requirements that a worker would have to meet, if a worker fears for the worker's life or health during an emergency due to the nature of the work being performed, the worker would be authorized to refuse to fulfill a job responsibility that is required or encouraged by the employer or relates to an unsafe work environment. The section C here just says an essential employer may not retaliate against the worker or any other worker in the form of discharge, disciplinary action, or other adverse action, for witnessing a condition causing an unsafe work environment, notifying the employer or a governmental entity of the unsafe work environment, or filing a formal or informal complaint. And then the limitation in this section is that in order to be protected from adverse action, the worker would have to promptly notify the Commissioner of Labor and Industry in writing within 3 days after the date on which the essential worker became available of the condition causing the unsafe work environment. Then the commissioner has some obligations sort of attendant to that. The commissioner has to promptly notify the employer of the content of the written complaint, and in its discretion may set forth requirements that the employer would have to meet to remedy the unsafe work environment. If the employer does not remedy the condition, in sort of compliance with any requirements that the commissioner would set, the commissioner would be required to assess a civil penalty of not more than $50 for each day that the condition causing the unsafe work environment is not remedied. And the amount of the penalty is capped at $1,000 per occurrence. And if the commissioner determines that there's a violation, the commissioner is required to issue an order compelling compliance and may assess a penalty of up to $1,000 for each applicant. That's actually a typo. It should say for each essential worker for whom the employer was not in compliance. And then there's some factors that the commissioner would have to determine in determining the amount of a penalty, the gravity of the violation, the size of the employer's business, the employer's, yeah?
I'm sorry. Can we just make sure that this is being streamed? There's a tremendous amount of interest in this, and I'm not sure that it is being streamed. And if it's not, let's just make sure. Let's just make
It's being streamed on live streaming service.
Says it's redirecting me. Looked like, oh, hold on one sec. I think we should be good now.
Okay.
Let me
Well,
know.
they'll
Yeah.
let us know.
Okay.
Yeah.
For what it's worth, when I pulled up the stream, it was Senator Augustine saying, I don't know if it's been streamed. So I don't know what the issue was, but it was saying on my end, I had to stop the live stream.
Okay.
So, but for anyone who's just tuning in, you didn't miss much. We just did a recap of what was discussed at the first meeting about areas of potential agreement with the definition of emergency and with the role of the state rather than MEMA or local emergency management agencies determining or announcing to employers that the requirements in the bill would be in effect. And then we were walking through section 316.05 of the bill, which we were just about finished with.
I just got a text that is live on Facebook now too, for whatever that's worth.
Oh man, is that, I don't think it's supposed to be.
No, it's not. There's no link on the, it's not showing up on our webpage.
All right, everybody switch to Facebook because I'm told that's where it's live.
Okay. I mean, do you want me to pause and try to reach Denise or like the tech people?
No, unless the other members feel, we'll try to get that corrected, but we can't give away this time. Are we recording this? Do we know if it's being recorded?
It should be, but I don't, if it's not streaming, I don't know how it would be recorded.
Yeah.
I have the stream up. It's working for me. I open the link and it's working.
Oh, you opened the link, but you didn't. If you go to our webpage, I don't see it on the webpage. For those who are trying to watch it through the webpage.
Jace, I just got a text that said someone was watching on YouTube. So I think maybe we can just proceed and we'll figure out afterwards what the technical issue is. But on my side, it's showing that things are sort of going. So.
Yeah, let's keep going. Let's hopefully this will resolve itself, but we have limited time, so keep going.
Okay. We were just about finished with section 316.05, which says that if the commissioner assesses a penalty, the penalty would be subject to notice and hearing requirements. The commissioner would be required to adopt regulations to carry out the subsection. And in addition to the requirements of the subtitle, an essential employer would be required to comply with any standards, protocols, or procedures that the commissioner requires, including an emergency or temporary standard. And that language, I believe, was included to sort of prepare for the potential that the federal government or the state would, Department of Labor would adopt an emergency temporary standard for COVID safety. That is something that Ms. Waterman is here to talk about. Some provisions of House Bill 124 would be potentially are being proposed to be amended into this bill. And so we're actually going to discuss that a little later in the context of Section 31606. But for this purpose, I just wanted to kind of point out that's one of the provisions that touches on the safety standards. So that was a lot of information. I'm going to just scroll back to the top of the section, and then if anyone has any questions or however the chairs want to handle discussion on it.
Senator Augustine, did you have any thoughts?
I'm good. I mean, we can keep going as long as folks are not shy about speaking up. Let's keep going.
I have a question. Laura,
Okay,
ask a question.
sure.
Just in the beginning, I've got a number of people asking how is an unsafe work environment defined? We say what it includes, but unsanitary conditions in the workplace seems to be extremely broad. And then the next one, it says an essential employer's failure to provide personal protective equipment. How do we know what that personal protective equipment is? You know, providing one of these things is a lot different than, you know, whatever other pandemic may be on the future, and not knowing what that, how that's defined.
Well, the definitions, you know, in the code, we have means definitions and includes definitions, and this definition has a means provision and an includes provision. When you have includes provisions, it can make a definition broader, right? Because it's saying things that can be sort of encompassed in the definition. But here we have an A1, you know, the means part of the definition. So it's a circumstance present at a work site that renders an essential worker unable to perform required daily duties because the physical condition of the work site represents a reasonable threat to the worker's health or safety.
Understand that one.
Yeah.
I mean, that one's again, if you look at this, 3, 4, and 5 seem to be fairly self-explanatory or referred back to something that an employer would be able to utilize. Unsanitary seems, again, a bit broad. And again, I think we are not sure the type of pandemic that might, and what the personal protective equipment might be necessary depending on what type of health emergency arises. But the next question is just really in terms of how does this end up in everyday working? You know, you're allowing an employer to notify a commission in writing within 3 days of I guess experiencing or notifying or seeing one of these unsafe work conditions. And then what the commissioner notifies of the complaint, and then based on just this letter, the commissioner will be able to say, here are the requirements that need to take place in order to remedy this. I mean, is there a visit out to the place of, you know, the work site? Or are we feeling that this is just going to be simple enough as somebody saying, hey, they didn't give me an N95 mask, and the commissioner writes a letter and says, give them an N95 mask?
My understanding, just in reading through how the bill is set currently, it leaves it to the commissioner's discretion to set forth requirements that the employer would have to meet to remedy the unsafe work environment. So that would be left to the department's discretion as to how, if they wanted to send a letter to the employer, call the employer, however they wanted to communicate, if it chose to communicate that there was an unsafe, they got a notice about it.
Okay. It's all in, am I on here? Yes, it's all in, I'm sure there's gonna be regulations, and I think there's two approaches here. You can either be really specific, or you can leave it a little broad like this, because we, as you said, Senator Hershey, we don't know what future emergencies we're gonna be dealing with. So there's two approaches: leave it broad and let the commissioner issue regs on how they're gonna approach these things, or get very specific to an individual type of emergency.
May I just ask why we are deviating away from OSHA? Because the way that the process is set up with OSHA concerning a hazardous work site would be, at first, you have to file a complaint. But if there is not sufficient time for OSHA to come out and do an inspection, then an employee may refuse work if certain conditions are met. And there are 4 conditions that must be met. The person has to ask the employer to eliminate the danger, and the employer fails to do so. You have to refuse to work in good faith, so that you genuinely believe there is reasonable apprehension of death or serious injury. A reasonable person would agree that there is a real danger of death or serious injury, and there isn't enough time due to the urgency of the hazard to get it corrected through a regular enforcement channel, such as an OSHA inspection. So I'm just curious why we're creating a whole different kind of definition and path here.
And I actually was going to ask the same question, but not with the specificity that Ms. Buckler was able to do. Partly because we ran into this in a meeting last night, where the bill sets up a whole administrative process, but it's actually already covered in the code. And so I was going to have a similar question: is there something in the code already, or, if we're following OSHA, that lays this out? And I, do sort of agree with Senator Hershey. Some of this, whether or not an employer has to provide personal protective gear may well depend on what kind of an employer it is. We obviously have not addressed the scope yet, but I don't think that we have made a decision that all employers are required to provide personal protective gear. Certainly healthcare facilities would have to, but law firms are still listed in here, and I don't know if law firms have to provide, that personal protective gear. So I do think that 1 and 2 are a little too broad. And, Chloe, you can probably speak to this or Ms. Waterman, I'm sorry to be more formal. Unsanitary conditions in the workplace. If you're looking at healthcare facilities, or as Ms. Waterman has, speaks to many times, some of the poultry factories on the Eastern Shore, I know they try to make them sanitary, but I'm not sure I'd ever consider some of those areas sanitary. So saying this sort of opens it up to an awful lot of, I think, abuse, where OSHA or in our code, we've already defined it. Why do we have to define it?
And I'll just add, Vice Chair, that, what we're talking about is each department has their own discretion. So in the Department of Labor, it's right OSHA. For healthcare, it's the Department of Health. Obviously, you brought up poultry. They're regulated federally as well, because of the fact that they're in manufacturing food. So we're trying to take a piece of Maryland statute, and it really is not a one size fits all. And I think we're trying to, by making this broad, we're trying to create this one size fits all, where this particular issue dictates otherwise.
And maybe should defer back to whatever the right statute is.
Well, I would just like to make the observation that, yes, we have all these statutes, but they all failed during this emergency, and they failed dramatically. Workers were in danger. They did not have the power within themselves to do anything if an employer said, you either show up or you don't have a job. And even though there were all these standards, they didn't work. And there was nothing in place for months in many places. So, and including even the state didn't provide a proper protection. So I think that if we're going to say, well, let's, just use what we have, then we have to go point by point on what we had and why it failed.
I was going to say, and maybe I'm wrong on this, but I didn't believe that OSHA put in place COVID standards. I mean, I know they have protocols for general pathogens, but they didn't have, I don't believe they still have COVID protocols that they've actually populated. So that might be a difficulty for us to just rely on OSHA in a pandemic situation.
I think what the suggestion is more that why are we recreating the wheel? If we need to apply the OSHA standards to COVID, that's fine, but lay out what has already, been, set forth as what the process is and what the definition of an unsafe work environment is. And to COVID, I don't disagree that everything seemed to fail, but at the same time, this was something that no one in generations has seen. But
okay,
Well, I think that's very important because again, we're trying to do something very broad here for any pandemic that might be on the horizon. And, to say that this was a failure or what happened was a failure, I don't know how accurate that is. CDC came back and said that most of the spread was not because of workplace, but because of community events, about 75% based on contract tracing information. So, you have to kind of put the blame where it needs to be. And, again, trying to be prescriptive. I understand what Laura said is, you let the department do some regs on how this is enforced, but just to broadly say PPE without really knowing what the pandemic is. I mean, we didn't know what to do when this first hit. And I don't think, I respect everybody in this work group, but I don't know that we could put together a piece of legislation that's going to tell us what to do when the next health pandemic comes that we have no idea what would be.
I appreciate that, Senator Hershey, but I understand. I actually think that what you're saying actually supports actually leaving it in as personal protective equipment instead of trying to go, you're, in other words, or we have to rework that which will provide safety to the worker in this type of situation. And so it's not, instead of let's focusing in necessarily specifically on this one, it really is, I think it does need to be broad enough that it's demonstrating the protection from the risk. And so that's what I think that is an important, I think that's an important part. I think the other things that folks have said about sort of, more aligning with the OSHA, which of course, number 3 kind of does that. It says it. I mean, they got to adhere to federal, state health and state safety standards. So it's in there. Maybe we need to reshape it such that it's not, so that that's a little bit clearer. So I definitely hear what everybody's saying now.
Yeah,
Malcolm, I don't disagree with you at all. I think you're right. We definitely need to focus on workplace safety, and I think maybe using some of the policies and OSHA motion things that are in place might be more helpful. But I agree with you there.
yeah.
Can I just say this, Brian? Can I just say one quick thing on this? When I think of the term personal protective equipment, though, I'm thinking that's very tightly identified with the current pandemic because we've been talking about PPE for the last year. I just wonder if there is I agree with you, Malcolm. I think you have to keep it broad. It's just that phrase is tied to this pandemic. Immediately, I'm thinking N95 masks. I'm thinking, and so I just wonder if we're really talking about the future, whether the PPE term, which again I really think of as been applied for a year to this pandemic, could be adjusted so that it's clearly sort of the sense is that it's not about the current COVID. So anyway, that's just kind of an observation. It just intuitively, I'm thinking about this pandemic when I see that phrase.
For the record, OSHA's term around that is required safety equipment.
That's broader and makes sense.
It's probably better.
Mhm.
Mm-hmm. So that was a point that I was going to raise. I'm sorry. That I was going to raise is, to earlier points, that given that we have some things that are codified in law that speak to then employee safety and the employee's obligation to provide a safe work environment, which I would say that most businesses do, and to the extent that there are bad actors, then you have regulations in place to go after those bad actors. Why not then speak to then those regulations and apply them to this bill rather than begin to codify other aspects in the law that are already in law, right? That businesses have to do. Businesses are inspected. If complaints are made, businesses are visited. They are fined already. They have to provide for a safe work environment. And those are fine, and there's no problem with that. The question about this bill, if to the extent that those things that are already in regulation have not come up to par, then what is the reason why they haven't come up to par? And let's make sure that in the future that they do come up to par, instead of trying to make then new regulations where in fact then we don't know whether or not those are going to be followed. So what I would suggest is that you look at the things that did not work, you make them work, but at the same time, let's not add other regulations that may in fact make it much more complicated that's already in place.
Okay.
Yeah.
So I, just another thing, maybe it's in here, or maybe it's not. Some of the confusion, I think, also was just, people just didn't know. I don't know if we have in here anywhere with some disclosures or requirements to share, information. Like a lot of people just didn't know. And I know this is an area that we got to work on. So, but I think we see a little bit of a path forward here with this. What do you think, Chair Davis? I'll take that as a yes. So can we move on to the next?
If I may, Senator, just before we move on, I just want to hone in quickly, sort of piggybacking off something Kaylee said with respect to OSHA and the process it lays out for right to refuse. The right to refuse provision in this section of the bill has significant implications for staffing and workforce. And the example I would give comes from my healthcare folks who are really concerned about the right to refuse provision, how it's worded, sort of puts the onus on the employee in the moment without sort of verification. And the fear here on the healthcare side, at least, as using my example, is this could lead to things like patient abandonment, et cetera, et cetera. And so I just don't want to move on from this section without sort of addressing the concerns that our members have about the right to refuse provision. And it sort of piggybacks off what Kaylee said in terms of pivoting back to what OSHA already sets forth in terms of a process for right to refuse dangerous work conditions.
What should be replicated in this?
Understood. Okay, I appreciate that. I think that we've got a sense of it. So, Laura, you want to move? You want to keep going?
Sure. Dave is actually covering the next section.
Right.
Dave
Yes,
is
I
doing
am.
31608. So let me scroll down.
This is actually not quite as complicated as what Laura just went through. This deals with adding an additional type of leave for employees to take who are essential employees under the bill. There's two kinds of leave here. There's bereavement leave, and then there's paid sick leave. And most of the section brings in the definition of family member, and that's the same definition that's in the Healthy Working Families Act. And the family member in this case only applies to bereavement leave. So an essential employee has to provide an essential worker during an emergency due to the death of a family member. And then you'll see that if you go further on in the bill, who a family member is, and again, it's the same type, it's the same definition from the Healthy Working Families Act. So you get bereavement leave if there's a death of a family member. However, regarding the paid sick leave, that's a little different. That's not quite as broadly applied. Each essential worker is entitled to 14 days of paid sick leave under the bill, but it is only for an illness for the essential worker during an emergency due to the illness and other health needs related to the emergency. So it has to be, the illness has to be related to the emergency, and they can get up to 14 days of paid leave. There's also some additional requirements that say that you can't use this leave, an employer can't force an employee to use this leave concurrently with the benefits under the Healthy Working Families Act. So it would be in addition to the paid, it would be in addition to the leave benefits provided under the Healthy Working Families Act. You can't require an employee to use them at the same time. And that's pretty much it. So the bill establishes two types of leave, bereavement and paid, and they're both paid. And but the paid sick leave only applies to the essential worker and can't be applied for an illness and a family member due to whatever the emergency situation is.
Yeah. So David, this is Chris. When this spring and summer, when we had workers that were sick, there was a federal standard, and the federal standard was backed up with financial support through the payroll taxes and thus and such. So I'm going to ask a rhetorical question for the sake of this conversation, which is we're broadly expanding the provisions under the Healthy Working Families Act. Where is the funding mechanism to allow for an employer to pay for 14 days of health leave? And what are the standards by which a decision
session didn't spell that out.
Wonderful, thanks.
And then the backup question is what's the standard? Is the employee just making this decision free of any doctor saying that there needs to be
There's no, well, this is independent. It's not, I wouldn't call it an expansion of the Healthy Working Families Act. This is different than the Healthy Working Families Act. So there is none of the provisions in the Healthy Working Families Act regarding verification, et cetera, are included under this particular section. It's just they're entitled to 14 days of paid leave. So, and the other part, you're right, it's rhetorical. I don't have any, nothing we.
Well, the federal,
that.
So the federal part, for someone to take that time, there had to be, the verification, right? It wasn't just somebody being able to take time off and getting.
That I don't know if there was, I don't know what was involved with the federal. We'll have to look into that and get back to you.
The observation is that you had this sort of mandate applied to the employer, but the federal government gave the employer the funding mechanism to afford to do that. And in this bill, it doesn't appear we're even coming to having that conversation.
Well, and if I could just chime in here, we have a separate bill to amend the Healthy Working Families Act because frankly, this doesn't go far enough. People are asymptomatic before they're actually ill. They spread the disease in the workplace. They bring it home to their families. They need time off to care for their families and to quarantine appropriately. So to the extent that this bill is more narrowly tailored to provide only sick leave to the actual sick employee, it's too narrow. I will say, Delegate Adams, to your point about the pay or about how to afford it, there should be mechanisms similar to what happened with the FCRA, where employers who actually have to pay out the leave can seek some form of reimbursement. And I've mentioned that on the earlier one, and I'll mention it again here. I would note also that for small businesses, the Paycheck Protection Act is still open for a second draw until March 9th, and sick leave can be included in those loans, which can be forgiven. So there should be ways to work together to ensure that businesses can afford this. But this frankly does not go far enough to make sure that public health emergency, we're able to flatten the curve and people can afford to stay home.
Well, Sally, just a reminder, the volume of money we're talking about, I mean, those are both federal programs that we were leveraging significant dollars, nothing that and this is my humble opinion, that the state could afford on a statewide level if employers are seeing this sort of usage.
Well, sure, if you're gonna, hopefully not every employee would need a full 14 days, especially if it's effective in flattening the curve.
But just to follow up what Sally said, I think it's certainly not enough. Like, we've had members who have had to quarantine 3 and 4 times at this point and are on 0 paid leave. They used all of the leave that they had. So they're quarantined now and they're having to stay home unpaid. So I think, it doesn't at all go far enough.
So I have two questions. One is this an unfunded mandate? And number 2, what about those organizations who in fact have labor agreements in place that may take this into account but may come short of this? Does the bill then override those labor agreements?
I don't think it's an unfunded mandate any more than the minimum wage is an unfunded mandate, or other worker protections are an unfunded mandate. And to the extent that this is a statewide bill, it sets a statewide floor around which bargaining and negotiations take place.
Yeah. I understand. I mean, I do understand the concerns, but let's go back to the point. This was a health hazard for the whole public. So workers didn't decide, and still aren't deciding, that they want to stay quarantined. They're being told you can't come back to work. And then if you do have employers who are saying, I don't care if you might be infected, you have to come to work. That means, an employer saying, I don't care about who you're going to infect, or if you've got customers coming in the door, you either show up or your job is gone, or, I agree with Rikara. There are people now in corrections and in social services and others that are on their 2nd and 3rd quarantine because they have jobs that just keep exposing them. Now we finally have a vaccine, but we're far into this. So we're not trying to do, also I keep hearing one size fits all, but we are, when you look at the OSHA standards, it doesn't really address something like we've been through. And we are doing, this bill is preparing for getting us walking out of this. Excuse me, that was one of my cats deciding to be part of this. And also, what if we have it again? And in this day and time, it may not happen this year or 5 years, but it probably will happen again. So I understand, people wanting to know a floor, but are we saying that businesses don't have to be part of the general public health welfare? And I know that's not what any of you are saying. So I'm just trying to figure out where our discussion is. Like, how do we protect the general public as well as our workers when this all is coming down?
One of the things we may consider, again, the 14 days of health leave is certainly what the initial CDC.
I would just also say that having to use your own leave is an unfunded mandate on all the workers.
No, you're absolutely right, Donna, and I understand. As to the 14 days of health leave, the CDC recommendations certainly changed over the course of the pandemic, and 14 days was certainly what we all heard initially. But the last several months, or at least weeks, it's been more sort of the 7 to 10 days. Maybe instead of setting out sort of 14 days, we should, indicate that they should be entitled to, provide an essential worker with the number of days of leave as recommended by the CDC, or, the appropriate, whatever. Still a mandate, and it's still, the businesses that are closing aren't going to be able to do it regardless. But, at least if it's defined and connected to a recommendation from a federal agency, as like I said, 14 days was what we were all told beginning, but then it got to 7 days or 10 days, depending upon what you were reading. And so maybe that's really what we ought to define it, or a way to define it. Still doesn't answer the questions that Delegate Adams has addressed, but maybe a better way to define what an employee is entitled to.
And just so I understand too, because there's no reference to it, if the federal government, say, provides leave, which they did, is this on top of that? And it's supposed to be on top of the 5 days of paid sick leave that we already have in statute?
I think it is supposed to be on top of the 5 days we already have in statute. But I don't disagree with you that there should be some correlation between what the feds might be providing and or what CDC is recommending. You're right. I guess I don't think it should be on top of the feds. I think it is on top of the 5 days of paid sick leave.
It's clearly, 5 days per year paid sick leave is barely enough for a cold. It's definitely on top of that. The federal law said that it could be taken, that leave could be used prior to accessing any other state or employer provided paid leave. So it would be, it would partly depend on what the federal law said, but this is intended to be in addition to, given that people are having multiple rounds.
Sally, the federal standard allowed, and I'm an employer and I had employees that availed themselves of the time off. That was not a substitute for the state mandate. The state leave remained while they took the federal leave. So what Vice Chair?
Yeah, that's what I was saying.
You all are agreeing.
I'm agreeing with the Vice Chair and where she's.
Oh my God, mark that down.
I got it.
And can I ask for clarification?
I just wanted to add one thing. There were some huge loopholes in who could take the federal leave. There were employers over 500. Some healthcare workers weren't allowed. So I just wanted to say there were lots of workers that were exempted that were not able to utilize the federal leave that we're talking about right now.
Can I just ask a clarification? Is a forced quarantine or isolation considered an illness? I mean, if there was a requirement for some reason to quarantine that could have occurred, let's say because you went to a restaurant and through contract tracing, the restaurant contacted you and said you need to quarantine or isolate, whatever the appropriate word is that covered under this then?
Looks like it.
It's an illness?
It's showing it. Other health needs related to the emergency. I would imagine that's, would cover exactly what you're talking about, Senator.
Yeah, well, that's what I was wondering when it said health needs. I didn't know if that was, related to the illness. That was my question. Is that covered through this? Is quarantine and isolation that might be a result of something that happened outside the workplace, then the responsibility of the employer to pay for that employee during this period of time?
Without a definition, Senator, defining illness or anything else, then you could probably broadly construe other health needs under the bill as in front of you.
Yeah, and it's essentially a public health provision. There's not a causation standard of you have to prove that your employer, or that the business was somehow where you might have contracted the disease. It's designed to enable people to stay home when they need to.
Okay, so then to follow up, is this 14 days annually or per pandemic or per emergency? I mean, if this emergency goes on for 2 years, it's 14 days during that 2-year state of emergency that we're in?
Yeah, Senator Hershey, the way it's drafted right now, it doesn't say, so I would interpret it as that is per emergency as defined in the bill.
All right, thank you.
Just really quick too, because the bill doesn't contemplate it, kind of like the federal provision. If an employer offers, say, a month of leave, this would be on top of that as well. So how would that work if an employer offers far more leave that actually would cover an additional 2 weeks?
I-
There are a lot
Go
of
ahead, Laura.
essential workers that get a month of leave.
Well, I think it depends on how you define essential worker, and based on the scope of the bill, I don't know any employee that's not an essential worker. We haven't
Yeah,
reached that point yet, but
I'm not an essential worker. I can work at home.
Me neither.
Okay,
Kaylee, I would think you would interpret this as the 14 days would be the floor.
Mhm.
And in that particular pandemic, and if an employer wants to go beyond that, they can go as far as they want. There's nothing preventing them from, but they can't go less.
Well, I was just going to point to the language here on the screen in paragraph 2. It's a construction provision that's similar to what's in the Healthy Working Families Act, that the bill may not be construed to prohibit an employer from providing additional leave. So, the employer can go beyond, but the minimum is what's spelled out in the bill.
I don't know if that was the question. I'm sorry, I got cut off. I got
So
cut
no
off.
matter, you're right. So no matter what the leave policy is, then what we're doing with this is adding this leave on top of whatever the leave policy of the employer is. Is that correct?
That's not my understanding. Certainly, I don't think that was the intent. This was a topic of extended debate with sick leave as to, can an employer's existing paid leave policy satisfy what's in the Healthy Working Families Act? And the answer was yes, if the employer's policy allows them to take it for the reasons under the law. And so it would be the same thing here. I think if the employer has any kind of leave policy in which the person could take it for the illness or other health needs, as long as it's 14 days and they can use it for that purpose, that would satisfy the requirement in the bill.
And in fact, we had, that had to be made clear in the Healthy Working Families Act. So there's actually a provision that was put in there to make clear that, as Laura said, as long as you have, if your leave policy allows leave to be used as in this bill, then you don't have to add, as long as you're giving them 14 days, you're fine.
Why don't we just add that clarification right into this section? I mean, from that bill, I mean, if that's true, if it's just a floor and, like you said,
Well, I think I think it depends on the language, right? Because we don't want people to be forced to use their entire bank of sick leave on one public health emergency and then have nothing else left. So
well, no, I mean, I agree it depends on the language, which is clearly, I think that's why we probably need to, this section probably needs some clarification. I mean, because obviously it could be read a little bit like Kaylee said, and that's not the intent, then, so either way, I think we need some clarifying verbiage here. Whatever the intent truly is by the spot. Sir Augustine, I mean, I'm looking at you. What's the intent? Is this a floor?
Yeah, I mean, Vice Chair Feldman.
Or
No, I think that's it. And I think that Laura and David, they explained it, including where she moved to, Laura, you had the part where it was showing that it was, that it was like, the prohibition and essential employer from providing an agreement. I mean, that.
No, I mean, I agree with that, but Kaylee, do you not think that, I mean, just back to your point, that particular.
Isn't that clarifying, Kaylee?
Is that not clarifying? You think?
Tell me why that's not.
Yeah.
Oh, it's not explicit like it is in Maryland Healthy Working Families Act.
The Healthy Working Families Act has a provision that says an employer's existing paid leave policy sort of satisfies the requirements of the act if the employee can take it for the reasons provided under the law.
Okay, so it sounds like we got a place to work. Thank you, Vice Chair Feldman. Sounds good. So were those the questions on this section?
I did have sort of the same question, Senator Augustine, I guess, and maybe we can work on this more, but yeah, that was sort of my question was, I think for the situation that Kaylee was saying, if you've got, a month already, but for workers that don't necessarily or have a small amount of leave, would we, if you're an essential worker that maybe only gets 5 or 10 days a year of normal sick leave, would this then get bumped up to 14? And would you have to use your regular leave? If that were covered fully under, if the quarantine was 14 days, is your entire sick leave gone because of your quarantine? Or I mean, maybe that can be nuanced in sort of other situations, but I had sort of a similar question, so maybe that can be addressed later on.
Well, and I also think this needs to reference the Healthy Working Families Act and amend in some of the language that's been worked out there. And taking another look at our bill, SB 727 would be great.
It is nuanced because you see the construction provision here says that the section may not be construed to require an employer to allow a worker to take the leave consecutively. So it does make clear that this would be on top of the leave under the Healthy Working Families Act. So we have to be clear about what leave is untouchable and what leave is, can potentially satisfy the requirements in the bill.
Laura, I thought we had a pretty good agreement just a minute ago. Now I'm not so sure. If you're an employer that gives an employee 21 days or 3 weeks of paid time off, they can use it for sick pay, they can use it to go on vacation, whatever. What we're specifically saying is we would not want to have a scenario where it's 21 days and then you add to that an additional 14 days. So now we're talking, in this scenario, 35 days of leave. And if I understood the Healthy Working Families Act, that bill provided a floor. So me as an employer, if I offered, 12 days of paid time off, I don't call it sick leave, I call it paid time off that the employee can use it for any purpose that they wish. I'm meeting the standards that was set forth in that bill. I think what we're asking, or our industry's asking, is to try to apply that same rationale and standard to this section. And I just want to make sure that's where we would find agreement in this scenario.
Okay, I guess I want to make sure that's what everyone is saying they want. I think the example that I provided about the Healthy Working Families Act and the way it's structured is different from how this bill is currently done. So are you all saying that you want it? It seems like there may not necessarily be agreement within the work group that is how it should be structured. I don't know, Senator Augustine, Chair Davis, I don't know how you want to kind of handle it, but so we would have to change this provision here about, I guess, the leave provided under the sick leave law would not be, depleted.
What I would say is I think that what we did talk about was trying to get some clarifying language. I think we should go back and look at that. But under the construction that you've already laid out, but that we do need to work on some clarifying language to address some of the concerns. I think that.
Yeah, there's, as Laura pointed out, you accrue the leave under the Healthy Working Families Act. Here, you're just given it.
This is different by definition.
This is different, and in reality, if an essential worker avails themselves, unfortunately, of bereavement leave, then we're talking 17 days, plus the 5. If they've accrued at least 5 days under the Healthy Working Families Act for that year, then you would add that into there. And the other thing, I probably shouldn't bring this up, but there's also an employer size requirement under the Healthy Working Families Act, where if you're 14 or under, it's unpaid. And if you're, if you're going to try to reconcile everything, there would be, I think, a lot of work to do here.
I don't think that there was an interest in doing that. And I think we also are getting far afield from the fact that this is a public health provision and that this was an important part based on the public health provision. And so it's something that's important. I do think that, like we said, there's some clarifying that we do need to to work on, and we can help use some of the language, but it's not the same, like you all have said. It's just not.
And if I could just add on to that, obviously this only kicks in the state of emergency. It's not like workers are going to be taking this leave willy-nilly on top of whatever vacation leave that they have. I would just want to point out with respect to the Healthy Working Families Act, we've actually been hearing from a lot of workers that employers just said, okay, well, now you just get 5 days PTO. You can use it for vacation or anything. So now they've lost vacation time and that they have to save in order to use their sick leave. So I wouldn't want this to be a situation where, for instance, Chris, you mentioned 21 days, but if an employer gives 14 days, I don't want this to be a situation where all of a sudden they have to.
I appreciate that, but we need to stay. I hear you. We got to stay on this one. We're running on time here. We got to sort of stay on this bill, which is about this. And so can we keep going?
Sure thing.
May I add to that though, because the other thing that we brought up earlier was the situation where the federal government provides leave. So is that also going to be a part of this floor that we're setting? So either if the federal government or the employer does not already provide that, then this kicks in.
No, I think that we get off the subject when we say, well, if you already have earned because you've worked enough years that you now have 14 days or 21 days of leave, and you're an essential employee, you've got to use up all of your leave during a pandemic. That is not the intent of how, I'm supporting this bill. This is for an extraordinary situation that we've been in. And we've now got people and thousands of workers who have used up all of their leave. And it's leave that they've accrued year after year after year, because there was a forced, you could not come to work and spread the disease. That's the whole point, is about spreading the disease, not because I want to stay home, not because I feel bad, and an employer isn't supposed to bring me back if I'm sick, but I had a disease or could have potentially spread one. And so I have a problem with even talking about saying, well, you've already got earned leave, so you use that up because you're a potential spreader or you have the disease, don't show up for work. But now you've got to earn your leave back year after year for something that you didn't do. Now, and again, I do believe that you have to have, you've got to have an order from a doctor or somebody saying you've got to stay home. That's one thing. It's not willy-nilly. This is not just because I want to stay home. This is because I have to stay home.
I understand.
Kaylee,
Yep.
For me, I felt like this was our state. This is we're saying for our state, this is our state floor. The federal government obviously supports us within that. This is our, but we are talking about, I think we're talking about floors here. I've heard you loud and clear in what you're saying. I think that is something that we got to think about, whether or not there needs to be, some language to it. But I hear you. I hear what you're saying with regard to, how the federal government's role in this. But I think that we're talking here about what we as a state see as being important. The federal government obviously can support and does support that. So I just want to think, I think we do need to think it through.
And Malcolm, can I just throw one quick thought in here also is, I'm listening to Donna talking about, I said this about the personal protective equipment. We do have to, though, get in our head that the next, quote, emergency may not involve anything about contagion and coming to work. And, I think we got to be careful just to not get in our head the current emergency and thinking about all these terms. The next one will be like this one. It may be an emergency that has nothing, again, to do with workers having to stay at home and quarantine. It might not because they're going to spread the disease. So I just wanted to, just kind of put that into mix as we talk about these terms and hypotheticals and scenarios.
Thank you. Definitely appreciate that. Yes.
Can I just raise one more, I mean, taking us not off path, but with respect to bereavement leave, and I'm about to introduce something that I don't have the answer to, but I know that the Senate just moved Senate Bill 473 addressing bereavement leave. And I don't have the answer to how these two things would intersect, but just want to be mindful of the fact that there is another bereavement bill moving separately.
The House has actually passed a bereavement leave bill, and it is, go ahead, Mr. Chair, do you want to talk?
I was gonna say, and correct me if I'm wrong, Laura, the bereavement leave that the House passed, it basically says if you have paid leave, bereavement is one of the reasons or one of the things you can use that leave for. So it's not a new leave bank or anything like that. It's just saying, and again, correct me, Laura, if I'm missing what it does. It just says if you have a paid leave policy, then bereavement is one of the uses you can use that for.
Okay, thank you, Mr. Chair.
It amends the Flexible Leave Act, which applies to employers with 15 or more employees, and just says what the chair said. You can use paid leave for bereavement purposes.
And we moved the same bill out of the finance.
Yeah, and it's non-emergency situations too. I mean, that's just the normal course of business. This,
would you all like to move on to the next topic?
Please.
Yeah, because it's so easy.
So next on the agenda is section 31609, which is hazard pay and financial assistance with healthcare costs. So the provision says that except as provided below, during an emergency, each essential employer shall provide an essential worker with hazard pay for each pay period that the worker works at regular intervals in which the worker is paid. The employer is not required to provide hazard pay if this is a typo, I should say, if the essential worker earns $100,000 or more. And the amount of hazard pay would be $3 per hour unless a collective bargaining agreement or similar agreement provides for a higher amount. The general rule, we discussed this at the first meeting, the general rule is that the hazard pay is retroactive to the start of the emergency. However, there is a separate uncodified provision in the bill that says that for the current pandemic, the hazard pay requirement kicks in when the bill goes into effect. The bill also says, notwithstanding any other provision of law, the hazard pay is not counted towards an essential worker's eligibility for state means tested benefits programs. And then this, I don't know if you want to talk about hazard pay as separately and then talk about the healthcare costs, or if you'd like me to run through healthcare before we open it up.
You know what, and this is just my thought, and I don't, mind whatever the group wants to do. I think the hazard pay issue is just going to be a legislative call. I think with the folks we have assembled now and those that are listening, there are those that are on one side of this and they're not going to move. And there are those who are on the other side of this and they're not going to move. And we can spend the next 5 hours talking about the merits of it or not. And when those 5 hours are up, everybody's going to retain their same position on hazard pay. So for me, like I said, it's a group thing and we can go through it. But that sounds like, to me, it'd be a waste of time to go back and forth, because everybody's going to make compelling arguments why we should do it or why we shouldn't do it. And ultimately, I think the legislature is just going to have to make a call on that.
Agreed.
Agreed.
Okay. So we're going to discuss the healthcare provision of the bill. So it says that an essential employer shall provide financial assistance for unreimbursed healthcare costs to each essential worker who becomes sick or is injured if the sickness or injury is related to the emergency. So for essential workers who have health insurance coverage, an employer can satisfy the requirement by reimbursing or paying copays, insurance premiums, out-of-pocket costs of medical coverage, or out-of-pocket transportation costs incurred or paid by the essential worker. And then it says also the employer can satisfy the requirement by providing medical benefits through the workers' compensation system. And can also satisfy the requirement by assisting the essential worker in obtaining and paying for health insurance coverage, such as helping the person obtain coverage through the Maryland Health Benefit Exchange during a special enrollment period initiated as part of the emergency. And notwithstanding any other provision of law, this financial assistance for the healthcare costs may not be counted towards a worker's eligibility for any state means tested benefits programs.
Thoughts?
Mr. Chairman,
Sir?
this one is the way it's constructed, it's not even seeming like it's acknowledging whether or not the person got sick at work. I don't know how you'd ever prove it, but I mean, if they get sick at work, I would assume workers' comp kicks in.
Not necessarily.
This is another example of part of the bill that borderlines on being unworkable. I don't know how do you ask a business to start paying, co-pays and I mean, not sure I have a question there. I just say this part of the bill appears to be unworkable.
Yeah, we factually know that the majority of contraction doesn't occur in the workplace. So why the employer would pay for those unreimbursed healthcare costs, I'm not sure. And we agree with the position that that's what workers' compensation is there for.
Yeah.
All right. Any other thoughts or comments on this?
Mr. Chair, could I just say though, on Kaylee's point, it's a little circular. I mean, workers' comp would only kick in if there was a causal effect between the workplace injury or whatever. And if you don't think you could ever prove one way or the other, then I'm not sure you would have potentially a problem going to workers' comp for the same reason. So I'm not sure how you get out of that circular loop a little bit, but.
Only thing I'll sort of say on the workers' comp piece is that at least the House has 2 presumption bills for COVID that are sort of currently being discussed. And in the context of those bill hearings this week, the testimony was that some workers are currently receiving workers' comp benefits through, I guess this is kind of a unique circumstance because we have this sort of sophisticated contact tracing. So there is an ability in the current pandemic to kind of identify, for some people, not all, the source of the infection. But I just want to add that.
That's why I said earlier, we have to be careful to get caught up in the current COVID tracing, contact tracing. The next pandemic or emergency, may not have any of that stuff. So that, we do, this issue of causation continues to be, kind of a boogeyman in a lot of the discussions here, certainly with respect to workers' comp. I don't know, we're not going to have, so anyway, again, I know I'm broken record on this, but.
Those bills are also in the Senate, I believe.
I think they're being heard on Tuesday.
Okay, yeah, somebody else on the committee works with workers' comp, but I'm sure yeah.
Ms. Delegate or Senator Feldman, I guess the circular point that comes back around full circle is the idea that if we don't think it's compensable under workers' comp, then where does the employer fit in having to pay for these benefits otherwise?
Well, I don't know if that's a question or a comment. I just would put the point.
Well, I mean, it's just, this is a part of the bill that you just can't, I don't see that there's no reconciliating this with industry, because we're not going to agree that the employer is responsible inherently for having to pay for things that they're not responsible for. But if I lose that argument and say that the employer is responsible or something happened at the workplace, then that's why we're saying workers' comp applies.
And it's not that the employer doesn't care. They absolutely care about the employee, but financially, it's not possible. Some of these costs could be astronomical and have absolutely nothing to do with the workplace.
Would you like?
And I agree. I think it is a problem if it's not specific, sort of is not covered by workers' compensation. I certainly believe that assisting an employee in getting help under a special open period under the health exchange makes sense. But if you're looking at B1 on page, whatever page it is, I've written all over it, so I can't.
Page 17.
Yeah, lines, 23 through 26. If the injury is related to the emergency, I think there you have to add that, and, related to the workplace, or occurred on the workplace. If you want an employer, that helps kick in workers' comp. But, I don't know if you can ask an employer if somebody got it because their child came home and had it, or their spouse is probably more likely. And then the employee contracts it, how you can, and then, and you're right, if they don't have health insurance and they are hospitalized and on a ventilator, you're asking an employer to cover those costs? I'm just putting it out there as something to consider. Again, if there's a long hospitalization and the employee, for whatever reason, maybe the employer doesn't offer health insurance, whatever, then you're asking the employer to pay 7 days of hospitalization and maybe living on a ventilator. I don't know if that's what we contemplated.
So when Laura and I review this meeting, is what do we say about this section from the group?
I think it needs more work. I think it's one thing if you can relate it to in my humble opinion, relate it to the employment, and workers' comp picks it up. And then it will depend on what we do with some of these presumption bills. But so line 27 through 32, I think is very problematic.
Agreed.
Sorry, Vice Chair DeMay. So you would say that you're saying, though, you're not saying that would be the case if the essential worker
contracted it on, if the injury
at the work site
can be was based on the employment.
Right. You're not saying that. Like you're
correct.
Saying you're talking about the other. So I think we got to work on it. But what you're saying with that, like you're saying for those that are not, and the way that it's currently written, it's
just open. I'm gonna
it's kind of broad.
Come back and my spouse got COVID, I got it, and so I'm in the hospital, and now you want the employer to pay. But I don't think that's, I think it might be covered under workers' comp if the illness was in fact injury was related to the workplace.
So isn't
workers' comp comes in?
Yeah, I think the elephant in the room around this whole bill is who's the essential worker, right? Because I think if we deal with then, for example, hospital workers, then that's obviously, you can obviously trace that to the workplace, right? However, if given the broadness of the bill of essential worker, it's very difficult to trace whether or not COVID or any other illness in this emergency legislation was contracted in the workplace. And so correct. we have to begin to define who is the essential worker. In some instances, this may work. In some instances, it doesn't work at all.
I agree.
All right, so back to that's fine. Again, what I don't disagree with the vice chair that, like, if we go all the way back for me, this has always been for me about these folks who are putting their lives on the line in the workplace. Mm-hmm. And in some instances, they just can't be made safe, but it is the workplace. So I think that, and they, and workers' comp may or may not. So if it could cover it, great. But if these folks are getting sick at the workplace, I mean, we got to make sure that that they're taken care of. And so
I agree.
I think let's try to work on it in that way. That's where I'm coming from. I mean, I hope that, maybe we can work on it to get it back to there. What do you all think?
Okay.
And Senator, I would agree with you. And I think, the whole thrust of this bill is to make sure that the workplace is a safe place. And I think that there's no disagreement in that, and there's no sort of retraction in that. The question then becomes is, again, how do you trace that to the workplace? If there is a workplace that is unhealthy and unsafe, then there are regulations in place to go after that workplace, and they should be. And if they're not being used properly, then let's make sure that they are being used properly.
Okay,
But
so I know we got to work on the definitions, but there are also workplaces that are by definition, have risks that cannot be controlled. I mean, they just, when we know them.
then let's identify who are those.
We are going to do that. We're going to do that, sir.
bill-
We got that. That's a part of what we're going to do. We're going to do that process. We right now, we determined that we were going to go through this part, and that then we would look at more closely defining who was in the class. That was the process that we agreed to do. That's what we're working on right now. So I think we got the feedback from this one. You guys, Laura and David, you guys heard kind of where we were coming from on it?
Yeah.
All right.
Yes.
Let's keep going.
Needs more work.
Yeah. But I think we got directionally, I think we know where we got to go.
So Dave is going to cover the next section, 31610.
This is pretty narrow section, and it basically says that an employer cannot, and this gets back to the hazard pay issue, that an employer cannot intentionally or unintentionally misclassify their employees for the purposes of not paying hazard pay. So an employer can't classify their employees and the worker as an independent contractor in order to not pay the hazard pay required under the section I was just discussed. And it's unintentionally or intentionally. And other than that, there's nothing else regarding this provision. It doesn't refer to there's no link to the other part of the law that deals with misclassification of employees. It just says that they can't do it. It's prohibited from doing that here for this purpose.
One question actually that I wanted to ask, if I may, Senator Augustine and Chair Davis, the definition of worker includes independent contractors as I read it. So I wanted to clarify what the intent was here with, let's see.
Laura, the way I read that is that if they're legitimate independent contractors, that's fine, but, oh, never mind. I just talked myself back into your question.
Yeah, the question is, Laura, and I had the same thing when I looked at it. So an essential worker includes a contractor or subcontractor. But there was I would think you meant employer, but I could be wrong.
So if the worker includes a contractor, then I'm just trying to think about how that fits in with the misclassification piece, because that provision says an employer may not intentionally or unintentionally misclassify a worker as an independent contractor for purposes of hazard pay, but we're saying that contractors are considered employees.
I don't know.
Or did you mean employer? I mean, that could be the other thing too.
You mean that the essential employer includes a contractor?
Yes. It's subcontractor that's what made me think twice, because I've not heard of workers, independent contractors being subcontractors.
I don't know.
I think
I'm not sure if the advocates for the bill have any kind of clarification on why I mean, I
Yeah,
know I
that makes-
drafted the bill, but I just want to make sure I understand what the intent is with the,
Yeah, I think there just may have been an issue with the drafting on that piece.
So we need to clean that up for sure. Hey, Chair David,
Yeah.
we're almost at 9:30. What are you, I know Miss Waterman has been with us, and I mean, I don't know, what do you think?
Do you want to clean up this last little bit before we let everybody go?
Yeah, I don't know if Ms. Waterman is willing to come back. If depending on, we just didn't get to her. She came to talk about her provision. I'm good with that.
Then you want to do that? I mean, at least let's get started on it. Maybe we can get it done, before we just have to depart. Since she came, yeah, let's go to that part.
Is everybody okay with that? I mean, she's just, she came to talk about her piece, so I figured.
Sure.
Okay, great.
Chloe? I mean, Ms. Waterman?
Yeah, sure. Do you want me to kind of set this up, or did you want to explain the amendment, Laura, or do you want me to just jump into it?
it's up to you. I can share a screen if you want and you can walk them through it, or.
Sure. Yeah, that sounds good. So the intention of this amendment, so, Delegate Valderrama has a bill, House Bill 124, which is intended to address the piece included in this bill around safe and hygienic working conditions. And so this is a proposal for how we could do that in this bill. And so the idea is that, OSHA is expected to put forward an emergency temporary standard in like 10 days is when they've said they'll do this. And so the idea here is that if OSHA puts forward an emergency temporary standard, we want MOSH to adopt that as soon as possible. Right now, they have 30 days to adopt it under the federal law, and we want them to adopt it as soon as possible. Now, if OSHA doesn't issue an emergency temporary standard, we are suggesting that MOSH issue its own emergency temporary standard that would be consistent with the voluntary guidance that OSHA has put forward already. So it's kind of like an either or situation, so that either way, whether the federal government acts or not, we would end up with a enforceable workplace safety standards here in Maryland. This would take the place of the section in the bill right now that is requiring employers to develop their own health and safety protocols. So this is something that Kaylee brought up during the hearing, that employers want actually guidance on what these standards should be, rather than they're not necessarily fit to create their own workplace specific health and safety protocols. So we're saying, let's scrap that part of the bill and let's all defer to what OSHA says. And then if OSHA doesn't get its act together and put that emergency temporary standard, let's have the permanent one. Let's create our own standard with MOSH. So the other things the amendment does is it keeps the whistleblower protections intact. It requires some reporting of positive cases to DLI. And that's just to be able to track, others have said workplace spread isn't a large factor. We really don't know that in Maryland because we have not been tracking cases by workplace. Department of Health can't tell you right now, which sectors have been responsible for a lot of cases in Maryland. And we need to know that in order to better control the disease. And then it also requires MOSH to report to the legislature on its enforcement actions. And this gets to the idea that, where have the failures been? And Donna and others brought this up. MOSH could have done the right thing and either used its general duty provision to cite and work with employers to bring them into compliance, or it could have created its own emergency temporary standard, as a dozen other states have done. It did neither, and it could have. And so this part is to create a little bit more accountability for MOSH with the legislature to say, okay, what have you actually done? If we have this emergency temporary standard, have you been actually enforcing it? So that's the idea of this amendment. This is all COVID specific. So while this House Bill 581 is looking at kind of all emergencies, this is mostly in non-codified language to deal specifically with COVID. And so I think the answer to the question of, well, what do we do about the next pandemic? And this gets back to that section around unsafe working conditions. The ideal in my mind would be for OSHA also to create a permanent contingency standard that would kick in that is specific to aerosol transmissible diseases. That's not included in any of this right now, but OSHA is expected to do that. They say they're going to do that within a year. Maryland would then have 6 months after that year for the state to adopt the federal standard. And so if that happens, which we won't know until a year and a half from now, then I think that whole unsafe working conditions section may be able to be struck, because that would also be addressed in federal law. So that's not in this, but I just wanted to add that piece because it related to the earlier part of our discussion around unsafe work conditions. I'll stop there. I think that explains it.
Is it possible that, and Chloe, in all fairness, I think I do have this language because we talked about this a while back. But is it possible to circulate this language with other folks so they can take a look at it? Because I wasn't. I don't think everybody has.
I can share it with the work group as long as Delegate Valderrama is fine with it.
Isn't this her bill?
Her bill is House Bill 124. This is the Delegate Davis's bill, House Bill 581. So what?
No, but this is already out there on the web, correct?
Yeah, I think it's fine.
It isn't really, because
Right.
her bill as introduced took kind of a different approach to this, because that was before we knew that OSHA would create its own standard. So earlier, her bill was kind of long and specified, here's what should be included in the standard. Now we're saying, let's not specify in the legislation what should be included in the standard, because OSHA's already given us strong guidance on that. So let's defer to their guidance, which is something, Kaylee, you've brought up, and I think others too. And I think that's a place where we have agreement, is let's defer to OSHA's guidance on this.
So now I'm lost. What's the point of dispute then? What's in dispute here?
I don't think there is any dispute, Mr. Chair.
There's
unanimous support for the amendment. Great.
Okay.
I can share the reprint. I just wanted to be respectful because it's Delegate Valderrama's amendment to your bill, but as Dave pointed out, it's being streamed for the world to see, so I don't see any problem
At
with
this stage in the game, nothing's secret from it's just all General Assembly property now.
Yeah.
And this was meant, the intention is for this to be a friendly amendment, right? That, you know, yeah.
Laura, you don't have to share the reprint. You can just share the amendment, even though it is just because
this is the reprint right here. But yes,
no, I know, but you could just share the amendment, and then it's just that language.
Right. Well, the amendment, Chloe pointed out, makes changes to the bill in some other places. Like there's a.
Oh, all right. Well, that's fine. Okay, that'd be good.
It sounds like we're good on that.
Yeah.
That's what it sounds like.
Yeah.
Agreed.
And it's the 1606 and
the amendment strikes that part of the bill that would have set up this requirement that specific employers develop a health emergency preparedness plan. So instead, this is just setting up requiring most to establish standards in the absence of federal standards.
Delegate Adams, were you trying to say something a moment ago?
I was just going to ask to look at this. I think that to be blunt with you, I think this does address in a substantive way the industry's position, which would be, if we're getting guidance, I think that a piece of legislation that way helps employers, not necessarily as a bill designed to hammer the employer. I would like to see it and just review it. I'm pretty thorough in reviewing everything, and would just like to see it before we adopt it.
Got it.
And I'll just add to that, since the amendment has been drafted, I've had some back and forth with folks representing different entities in healthcare who have some kind of specific issues that are still being worked out. For example, congregate healthcare settings are already required to report positive cases to MDH, and those you can just look online and see already. So we don't necessarily need those reporters to also be reporting to DLI and that information available in two separate places. So there's some minor issues like that I think we're coming to agreements on with the healthcare industry, but may include a few further changes to the text that Laura has right now.
Okay. Chloe, could I ask a question? Are you saying that, because I saw the stuff that was struck, that businesses or, state entities or anybody would not have to have a hazard plan? That it would just be the OSHA, one size fit all, which is what we keep hearing doesn't work. One size fit all, everybody's so different.
So Donna,
and what was the biggest problem was there was no hazard plan in work sites.
So what I expect OSHA's emergency temporary standard will do is classify different workplaces based on risk level. And for certain workplaces that are higher risk workplaces, part of what the emergency temporary standard will do will require workplaces to develop workplace specific plans that are consistent with and kind of supplement the emergency temporary standard. And so it's the reason that I think it's appropriate to strike that section around employers creating their own plans is because then employers could essentially be asked to create their own plans in two ways. OSHA may ask some employers to create their own plans if they're high risk workplaces, and they'll give guidance. But I think striking it speaks to Kaylee's point that we don't necessarily want workplaces to employers to be coming up with their own plans for a few reasons. They're not really qualified or trained to do that necessarily, and they don't have the support in doing that. And B, then if they're required to create their own plans from, I think the proponents of this bill's perspective, of which, I am among them, then we also have the problem of why wouldn't an employer just create a pretty weak plan and say, okay, well, we have this plan and we're following it, so that's good enough. So I just don't think that the plan where employers create their own hazard and safety plans addresses, is suitable for either side, basically.
Well, a long history in labor is that labor and management have worked very much over, centuries actually, but one of our big thing is health and safety and working in health and safety committees with management and defining, what are the hazards here at work and what needs to be put in place and being able to develop that. So because each work site is specific, whether you're in LabCorp or you're working at Fort Meade, they're both dangerous, but they also have some other issues that they need personally in those sites, because one size doesn't fit all, as is said. So I would not want to see any of the, because there's a lot of employers that do have good health and safety standards, and I wouldn't want to see that watered down. And so I kind of have, I do have an issue with this. We need to look at how to put the language in, because it's much more, it's much more effective, even at the work site, when management and labor are working together. And that's not even through collective bargaining. There's a lot of companies that also involve their workers in, developing health and safety standards. And so I would not say that we should say either or, but maybe have the combination in this.
Okay. All right, we'll definitely note that. This probably looks like a good place to stop. It's closing in on 9:45, and we've got to be on the floor in the House 10. So we'll take that. David, Laura, did we hear anything, any feedback from outside the group, from those that were you all sent in anything or?
I received, I think I received something from NFIB. And I was sent to the whole group, so.
Got it.
I received a couple of amendments to take certain industries out of the scope of the bill.
We'll worry about who gets eliminated some other
right.
Okay. I just wanted to make sure, because like I said, I know we know others are so, and we had encouraged them if they had some ideas to submit them, but saying exempt me is not the idea that we're looking for. But with that, Senator Augustine, unless you had some things you wanted to add or continue, this is probably, as I said, a good place for us to stop so we can get on with the remaining business of the House. I think Laura and David, you guys have maybe enough stuff where we can get updated a little further. We're quickly coming to the point, I think, where maybe another meeting or two, and then we're probably going to have to wrap this portion of it up and get to our respective chambers and committees and just make some decisions one way or the other about where we're going to go. So again, for the group and for those who are listening, with the remaining points that we have out there, if you have any information you want us to consider or want to submit, I would encourage you to do that, to share, certainly with Laura and David and really the rest of the group, just so these are things we can have in mind and contemplate as we continue to move forward. And, the process will lead us where it leads us. And, I know everybody's working hard, doing the best they can. So I certainly appreciate it. It's not easy doing this at 8 o'clock in the morning when I know you all have long days. So you certainly have my appreciation. And Senator?
I agree. I want to say thank you, and we'll keep working. Thank you.
All right, guys. Thank you all.